Hi everybody, my name is Maisy Valdez and my presentation is on prematurity. So, what is prematurity? Prematurity basically means when a woman is not able to get to her gestational time period during a pregnancy, which is a total of 40 weeks. There's different categories which a woman would fall under based on how much she was able to carry the baby. It begins from less severe all the way down to fatal, which could potentially cause death. The first one is late preterm, which is between 34 and 36 weeks of pregnancy. The next one is moderately preterm, which is between 32 and 34. Following very preterm, born less than 32 weeks. And extremely preterm, which means that the baby has been born before or after 25 weeks. This usually means that the baby has a very slight possibility in actually surviving. So this is an overview of what my presentation is going to be mostly about. I'm going to be speaking about signs and symptoms, risk factors, diagnosis, preventions, management, and prognosis. So for starters, there are many different complications that associate with preterm labor. One of them is when the baby is not developing correctly, meaning when it has immature lungs, kidneys, heart, anything that potentially could cause the baby and its organs to fail. After is difficulty breathing. When a baby is not getting enough cervical fluid while he is in the mother's womb, it causes the baby to stop breathing the way that it should. This is very common among younger women and older women. Another one is slow weight gain. If the baby is inside of the mother and it is not developing and gaining enough weight as it should be week by week, this could be a cause for the baby to come early. Heart problems, as I mentioned before, it also goes with the category of immature lungs because it usually tends to all fall together with heart problems, lung problems, and following kidney problems. And disproportional body parts. When a baby doesn't have the right body movement, such as the head may be bigger than the arms or the body is not big enough for its head, it usually causes for the baby to come early as well. Risk factors. So these are different risk factors that the mother tends to go through when she is experiencing a preterm labor. So abusing substances while pregnant, carrying multiple babies, so meaning having twins, triplets, etc. The age of the mother, as I previously mentioned, is a big factor. Having a child tends to have more difficulties in being able to carry the baby full term because she is not fully developed yet. The same way goes with an older woman trying to have a baby to carry full term because of the hormones level in her body, and her eggs are not as mature as they were once upon a time. Domestic abuse. So when there's a family that the mother tends to be abused physically, stress-wise, it usually can cause obviously preterm labor because this goes all corresponding back to when a mother is being hit physically. It can obviously impact the way that the baby develops in the womb. Sexually transmitted diseases is a very big factor. Because gonorrhea and chlamydia, there's not too many obvious signs other than just you personally feeling uncomfortable at times. It is very hard to catch it early on and treat it so that the baby doesn't end up getting affected by it. Also, HIV is a big issue when it comes down to premature labor because there's no actual way to separate the baby's blood and the mother's blood from getting into contact and being infected with this disease. Diabetes is also another huge factor because of the insulin that the mother takes. Sometimes it gets passed on to the baby, therefore the baby is infected as well. And UTIs. UTIs is the #1 cost issue with infections worldwide for prematurity. This is because it is very hard to catch on time, and it's very easily treated, but it's very hard to actually be caught on time and diagnosed properly so that the baby's not affected long term. Diagnosis. So the diagnosis is meaning talking about once the baby is out of the womb, whether he or she is born 25 all the way up to 36 weeks. They automatically go into the NICU. It's the neonatal intensive care unit. This is a unit special for babies that are born premature or have any type of condition that needs to be treated. They check for fluid inputs because the baby's mouth usually is not big enough to hold a nipple or the mother's breast. They need to be fed through a tube. So there's a tube that is connected to their mouth, and that's how they measure how much input goes in, of course, as well as measuring how much bowel movement they are having. Blood tests are taken very frequently. The reason for this is because babies that are born early have a very high chance of their glucose levels to get mixed up and go high and up and go back down. So they want to make sure that they're being able to treat that properly. Also, they check for infections or low iron, which could cause anemia and such. Echocardiogram is it's sort of like a ultrasound, but it's for the heart. It catches the waves of the heart, and it pretty much is able to see if the waves are intact with how the baby's process should be, or if there's something that needs to be done for the baby to be able to have better function. Maybe a pacemaker needs to be put in place, or things like that. Ultrasounds are also done because of brain bleeds and fluid levels that can be found anywhere from the brain to the abdomen. So they want to make sure that none of these things are an issue, because it usually tends to happen when small children have kidney failure. So there's something that they can constantly check for. And eye exams to be able to make sure that the baby is able to see properly. How to prevent. So there are many different preventions that the mother can take into action while being pregnant, so that this doesn't occur. Not drink. It doesn't matter if it's beer, wine, or liquor. Alcoholic beverages are not acceptable during pregnancy whatsoever. Not smoking tobacco or anything related to that. Do not do recreational drugs such as weed or anything that you could possibly think of. Making sure that you are staying with a healthy eating habit and a healthy nutrition plan is a key point to make sure that your baby is getting all the correct nutrients that it needs to be able to develop properly and be able to carry a full term. Avoid lifting heavy things, because as I previously mentioned, that there's an age group with younger children, younger teenagers, and older women. They believe that, oh, I'm okay, but they're actually at very high risk of actually having a miscarriage or having preterm labor, because their uteruses are not strong enough to sustain the baby. Therefore, when they lift heavy things, their uterus sort of opens, and it's very easy for the baby to come into labor, and that's something that you obviously don't want. Be aware of chronic illnesses. If anybody in your family has had heart problems, kidney problems, lung problems, that's something that you should be aware of, because most likely it could be passed on to your baby through genetics. And avoid infections. Infections, as I previously stated, UTIs are a major issue when it comes down to premature labor, because it is so common, but yet it is so hard to be caught on time rather than later on when it's going to cause further effect to the baby. Management. So premature babies most of the time need long-term management of health-wise and parents' intervention, because a lot of children that are born prematurely don't always develop their muscle movements correctly. So a lot of the times when children grow up and they're premature, they can be paralyzed, they can be in a wheelchair, and they can have very minimal movement from the neck down. Impaired learning. So what impaired learning means is that their ability to learn as quick and as much as other children is a little bit harder based on the studies that have been provided. And this is obviously dated back to premature labor, something that it's not, people don't realize that it's such a big issue, but it is, because it can affect them long term. Hearing problems and chronic health issues such as infections, feeding tubes, and sudden infant death syndrome. Sudden infant death syndrome is very common in the United States. but mostly among premature babies. It has been noted that about 85% of children 6 months and under that have actually developed and been born premature can actually this can actually happen to them because they are not used to breathing as good as they would in their womb. So once they come out, it takes them a little bit more time to actually get used to and learn the routine of breathing on their own during the nighttime. So the prognosis, 15 million babies are born premature around the entire world. And this is a yearly statement, and this was last stated in 2015. 95% of the babies born 32 weeks and above survive, but only 30% of the babies born 24 weeks and less survive. So out of 100%, only 30% of those babies survive, and there's 15 million babies being born a year. So that's a huge number that honestly I believe that something needs to be done to be able to change that, so that the population can be more aware of certain things that we can do as a whole to help mothers, and so that kids don't have to go through those things. It is estimated that both numbers will increase in the next 5 years due to high technology that is happening all around the world. So that's a very good thing, because it's obviously something that we want. We don't want children to continue dealing with this for years to come. Implications for parents. So what this means is that as a family, when you have a child that is normal, of course you tend to be happy and have a normal family. But when you have a child that has different disabilities, not necessarily always physical, but internally, maybe your child has a chronic illness, or maybe he's paralyzed, as I said, from the neck down, or has hearing problems, it tends to be difficult on the family and the marriage as a whole. So based on my studies, it shows that 5% of families that go through this issue actually end up getting a divorce because they don't have the proper support from each other to be able to deal with an issue like this. So implication for teachers, because this is a long-term effect on children, teachers that deal with children that have certain disabilities like hearing problems or being able to pay attention, they need to fix their teaching style to accommodate these children. Not all the children are going to be, of course, in inclusive classrooms with all the different children, but they might be in special need classrooms just because they need a little bit more attention, a little bit more help. So this is where teachers come in and they change and they alter the way that they teach and the way that they approach certain situations based on the needs of the children. So, initiative on a national level. So, in 2004, the Prematurity Research Initiative was started. This is a funds research program that goes and funds certain hospitals to do research as to what causes prematurity labor and how we can change certain things and alert the population on this issue so that it doesn't continue to happen further on in the future. And the most important thing that I want to just emphasize is the fact that, as I previously mentioned, infections involving the woman's uterus, so UTIs, gonorrhea, chlamydia, anything like that, is the #1 cause as to why premature labors actually happen. And this is something that can be treated and can be actually caught on time. And anytime that you're feeling something as a mother, you can't be scared to actually talk to your physician about it. Even if it's something small, it can truly make a difference in saving your child and your life and your whole entire future, the way it will play out. These are my work cited, and I hope that you guys enjoyed my presentation. Thank you so much for watching.